Hi, Dr. Greg Scott here. Today, instead of writing out a blog post, I wanted to do a little short video. And the topic today is going to be about vitamin D. And primarily, I'm going to be talking about how do you determine what dosage vitamin D you actually need. Now, I could go into a lot of detail about vitamin D and what it's good for, and all these different aspects of vitamin D, and it would take up a lot of time on this video blog today. But what I really want to do is just say that vitamin D is crucially important. I think that vitamin D is one of the top 5 things that you should be looking at and paying attention to with your own personal health to prevent chronic disease and ultimately, hopefully, to live a longer and healthier life. And so I'm going to leave it at that for right now. Um, Now, the reason why I'm talking about dosage is because I came across a post on Facebook where somebody was really confused about what dosages they needed to be taking. And they had been on a really high dose, and then they got off of it, and now they have almost like a chronic fatigue kind of situation going on. And so I just wanted to make a few comments upon that. I think it's vitally important that in determining dosages for vitamin D and most other vitamins, that you actually do some kind of laboratory testing to determine the need for it and then how much you should be taking in response to how deficient you actually are. And vitamin D would be absolutely up there upon one of the vitamins or minerals that I think you should be looking at in that manner. And there's a couple reasons why. First off, adequate levels are and what was usually seen on the reference ranges is not really representative of all of the benefits that you could actually get from vitamin D levels. And what I mean by that is on a typical blood test, the reference range is usually the low end of the reference range is usually around 30 nanograms per deciliter. A lot of people are going to fall below that and have a demonstrated deficiency. But if you fall at 31 or 32, then traditional medicine may not recommend that you actually get on any kind of vitamin D. And so, what I want to argue and present to you today is the idea that having a elevated level, probably instead of having 30 be the minimum, having 50 nanograms per deciliter be the minimum, is where you're actually going to see the maximum health benefits because vitamin D, uh, like I said, it plays a role in the prevention of a lot of disease, but it's calcium regulation, but also basically helping prevent type 1 and type 2 diabetes, autoimmune disease, multiple sclerosis, cardiovascular disease, osteoporosis, all these different things. You get the maximum health benefits when your ranges are somewhere in the range between 50 and 80 nanograms per deciliter. So we want to actually determine that we're getting to that level. And depending on how deficient you are, you may or may need uh, you may need more vitamin D. You may need 7,000 international units per day. Or if you're sitting at 45 and you want to get it above that 50 threshold, then you may only need a couple extra thousand international units per day to achieve that. And so, if we're on the high end of vitamin D, let's say we decide to treat ourselves without getting the blood test done, and we end up with 120 nanograms per deciliter of vitamin D in our blood, that's actually a dangerous situation. There can be toxicity issues associated with that. And if that's done in a chronic situation, that can actually increase your risk of cancer. So we don't want to dose too much. And then the opposite end is that if we are deficient, then we want to achieve those adequate levels. And there's a couple scenarios that sometimes people can run into. One is if you don't have a gallbladder anymore, that's going to affect what kind of vitamin D you actually want to take because you're probably not going to absorb just a full fat version of vitamin D. Vitamin D is what we call a fat soluble vitamin, which means you need bile and good fat digesting capabilities in order to absorb it and utilize it. And so, if you don't have a gallbladder, then you have a decreased capability of absorbing fats. And so, what you should be recommended for those types of people is that you actually get an emulsified version vitamin D so that it's more easily absorbable, more bioavailable essentially. The other scenario that can sometimes happen is that maybe you have been taking vitamin D for a long period of times and then you get the test done and you see that there's actually still a deficiency and you're scratching your head. It's like, do I really need to increase the doses a little bit more? And the answer is probably not. If you've only been taking 400 international units, then maybe. But if you've been taking 5,000 international units and you're still deficient, then yeah, you might want to consider some other things actually instead of increasing it to something like 10,000 IU's a day. And what that actually means is that you're probably having some kind of intestinal issue going on where you just don't have the capability of absorbing it. And things like leaky gut, small intestinal bacterial overgrowth, Crohn's disease, those are the kinds of things that we would think of with a malabsorption type of situation. And if you have been taking vitamin D at a high level and you're still having deficiency, then it's probably appropriate time to start considering some of those things as an option or as a reason to why you're not absorbing vitamin D. And by the way, it's not just vitamin D that you'll become deficient in, it's basically everything. You're having malabsorption of everything. And so again, I just want to emphasize that I think testing for vitamin D is really, really important. And by just treating yourself depending on what everyone else is taking or what's the average of what people take or however much you feel like taking, that's essentially the equivalent of accepting quackery as mainstream medicine, where you're just somebody's coming up with how they feel about a condition and then treating it based on those feelings. And I would plead to you that you actually use more scientific and objective methods to achieve the appropriate amounts of vitamin D levels in your blood. So I hope this helped you guys. Hope it was interesting. And if you do want to get this test done, it's a cheap test. It's less than $30 in my office. It's really easy to do. Very cost-effective way to improve your health. And so if that's something you're interested in, you can give me a call at 913-701-6708. And I hope this benefited you. And thanks for watching.